Welcome to This Explainer, where we are digging into a big new review from the Journal of Dentistry. It asks a really important question. How good is AI, really, at spotting jawbone loss? And you know what? The answer is a whole lot more complicated than you might think.
All right, let's set the scene. Every single dental professional knows this struggle. You're looking at radiographs, trying to gauge marginal bone loss. It's absolutely crucial for diagnosing periodontitis, right? But it's also slow. And let's be honest, it can be pretty subjective. What you see, another clinician might see a little differently, especially when comparing images from years apart.
So naturally, this leads to the big question everyone's asking. Could AI step in and do this better? Could it be faster, more objective, more accurate? Well, that's exactly what this huge new review set out to discover, and it's got some fascinating answers for us.
And the first part of the story is, I gotta say, incredibly promising. When you just look at the raw numbers from the lab studies, AI looks like an absolute superstar. The researchers didn't just look at one study. They did something called a meta-analysis, where they basically pooled together the data from 16 different studies. This gives us a much stronger signal. And what they found was some seriously impressive performance. So let's look at this first number, 92.3%. What is that? That's the pooled sensitivity. In plain English, if a patient actually has marginal bone loss, the AI is going to correctly identify it more than 92% of the time. That means very few cases get missed. That's a big deal. And then, on the flip side, you've got specificity. At 91.7%, the AI is also really good at correctly saying, nope, no bone loss here when a patient is healthy. This is just as important, right? You don't want a system that's just crying wolf all the time. And this last number, 0.97, kind of ties it all together. It's the area under the curve, or AUC. All you need to know is that a perfect score is 1.0. So 0.97, that is fantastic. It tells us the overall diagnostic ability is excellent. So in a perfect lab setting, AI looks amazing. But, and you knew there was a but coming, that's not the whole story.
Now we have to talk about the reality of this situation. Because for all those stellar numbers, the review dug up some pretty critical limitations that show the massive gap between what happens in a research lab and what happens in a real clinic.
First, and this is a big one, is the validation gap. Basically, most of these AI models were only tested on data from the exact same place they were trained. Think of it like this. If you only practice for a test using one teacher's notes, you might ace that teacher's test. But what happens when you take a test from a different school? You might fail completely. It's the same idea here. An AI trained in one hospital might not work at all in another.
Okay, second problem, the time gap. This is a huge deal for periodontics. A massive part of managing the disease is comparing today's X-ray to one from a year ago or 5 years ago to see what's changed. Well, guess what? The review found that 0 studies tested if AI could do this. Not one. That's a fundamental part of the job that, right now, these models just can't do.
And finally, we have the real-world gap. Let's be real, daily practice is messy. Our radiographs have artifacts from fillings, crowns, implants. They're not always perfect textbook images, but it turns out nearly 60% of these studies just tossed out those messy images. They fed the AI a diet of perfect pictures. An AI that can't handle the messy reality of a busy clinic isn't really ready for that clinic, is it?
So after all that, what's the take-home message? What does this mean for you, the clinician who might be thinking about bringing this tech into your practice?
It really comes down to this simple contrast: promise versus reality. The promise is sky-high accuracy, in a bubble. The reality is that its actual clinical readiness is seriously limited by these gaps we've been talking about, gaps in validation, in tracking over time, and in real-world testing.
So, based on where the evidence is today, the role for AI isn't as a replacement for the dentist, not at all. It's a support tool. Think of it as an expert second opinion that's always on, or a way to make sure everyone in a group practices on the same page. But the review makes one thing crystal clear. Human oversight, your clinical judgment, is still absolutely essential. The buck stops with you.
Which leaves us with the big question for the future, doesn't it? Is this technology going to become a true standard of care, or is it going to stay a really promising experiment? For AI to make that leap, the next wave of research needs to get serious about closing these gaps. We need to see it validated in diverse clinics, we need it to track bone loss over time, and it has to prove it can handle the imperfect images we see every single day. The potential is definitely there, but the path from the lab to the clinic still needs a lot of work.